I thought it might be fun to make a video about just 6 quick sort of functional tests that you can try at home. So if you're interested in these topics on airway dentistry, like should I be investigating this further for myself, for my kids? Here are some tests that you might want to try. Not all of these are meant to be like diagnostic, as this isn't any sort of official diagnosis or anything like that. So if in doubt, go see an airway trained provider, be it a myofunctional therapist or an airway dentist, ENT, whoever is the right person to help you. And if you need help finding that professional, let me know. Without further ado, let's go ahead and jump into the fun part. Let's do some tests. First up, I was going to present to you what's called the Glatzel mirror test. So this is something that is an old test. It's over 100 years old. It's used much more commonly by speech language pathologists during evaluations more than like ear, nose, and throat doctors. And it's just a really quick check on what we would call nasal patency. So, kind of checking when we exhale, is the nasal passage open on both sides, and kind of checking the amount. So, you'll see it's something, there are definitely more official tools that can be used. Some people have a mirror with like a grade, kind of like a ruler on it, and that will help show when we do kind of a puff out of air and it fogs up the mirror, that can show kind of how far that radius goes as an indication of how much air came out. So I think this one's just a fun one to do, and you can actually do it with just a shiny phone case if you want. So let's give it a try. You want your phone case to be off, so no phone or no photo or anything is showing. And you can take it up to your nose and just breathe in, and then you'll seal your lips and do a little exhale puff out through your nose. So both of my nostrils are fogging up the glass to about an equal amount. Obviously, this one's not hugely diagnostic. And one thing to keep in mind is that our nostrils actually do cycle through periods of time where one is going to be more open than the other. So checking it once in isolation isn't anything to worry about. If one nostril is kind of blocked, check it a few times throughout the day. But this one's just a quick and easy little test that you can try. Test number 2 is going to be a 3-minute timed test. There was a test called the Rosenthal test that's typically like a 1-minute timed test. I like to rely on a 3-minute timed test instead because I've seen more kind of literature and science to sort of validate it. Specifically, you can either try and tape the lips shut for a period of 3 minutes. You can try and take a sip of water and hold it in your mouth, because if you're holding water in your mouth, then it's going to force you to breathe through your nose during that time. As far as the reference goes, the research that I've seen, there was a study with Dr. Zaki, Cynthia Peterson, and several others. They looked at doing this test with taping the lips shut. And the subjects who could not complete this test had, the result meant that they indicated that they had a 4 times increased likelihood of mouth breathing while they were awake, and a 3 times increased likelihood of mouth breathing during sleep. So breathing through our nose should be really effortless. If it creates anxiety to have our lips taped shut, or to be forcing ourselves to breathe through our nose, then that's a really good indication that we're going to want to dive in deeper and look at, like, is this more of a true obstruction somewhere? Do we have something going on inside the nose that's making it hard to breathe? For a lot of kids or adults, if they're just a mouth breathing habit and that's all it is, it's just a habit, then doing this test may not be stressful. Like they can do this test without creating anxiety. And that's a good sign that maybe we just need to be training the strength and retraining the habit. If you were going to try it with some water, you could take a little sip of some water and set a timer and just do exactly like that. Hold that for 3 minutes and see how you feel. Does it create any anxiety or is it pretty easy? Alternatively, if you want to try it with some tape, and mind you, this is not something I'm not recommending taping your kid's mouth shut. If you want to do this for your kid, talk to me, send me a direct message. We'll chat about different ways to validate this. But if you're an adult and you want to test it on yourself and tape yourself, then go ahead and just take a piece of tape. It doesn't have to be any of the fancy ones that you see advertised for lip tape at night. It can just be little micropore tape and set a timer, 3 minutes, see how it goes. Let me know. About next, the Cottle Maneuver. So in the Cottle Maneuver, this is a good one to look at if we are wondering. So sometimes the point of sort of difficult breathing can be what's called either the internal nasal valve or the external nasal valve. And these are related to really kind of the nostrils. The internal nasal valve will be a little higher up, kind of upper edge, upper portion of where the nostril meets up with almost like that bone where the bone starts. And then our external nasal valve is actually kind of this outside nostril portion. So first we're going to look at the Cottle maneuver, and that is going to be used to check so you can either you yourself or if someone goes to see a doctor, they can put their fingers just kind of at around where that bony ridge of the nose begins, but out on the cheeks. And what you want to do is actually just kind of gently pull away, like push in a little bit with some pressure and then pull out and sniff in. If you notice that there is a difference in like the ease of breathing with that, that can be a really good indication that something like an external dilator can be really helpful. So something like the Breathe Right strips or the intake little now magnetic version, those can be helpful if your nostril is kind of collapsing that way. And then on the flip side, I'm going to teach you about the Davidson maneuver. So I just read about this in her book. Karen Parker Davidson has a book called Breathe Through Your Nose, Don't Pay Through It. And a lot of times when people are checking the external nasal valve, they do like a quick sniff in test to see if it collapses. This one, we're going to go ahead and instead of doing like that quick sniff test, which you're welcome to try, we're going to take just our finger and lift up, kind of making like a little piggy nose and breathing through that and see, compare that once you let it go, going back and forth to your normal way of breathing and seeing if that's easier. If getting that nose position up does make it easier to breathe in, then that's a good sign that those little internal dilators, so things like the mute, sleep cones, different things like that, can be helpful for you. So that's something that in our dental clinic, we actually used to, for some patients that would have a hard time breathing while we were working in the mouth, that would be something that we would offer is they could try out nose cones while having a procedure done. And so for some patients, they were like, I've never felt air touching that part of my nose before. So it can be a really interesting experience if you've never tried that or had the ability to breathe that way. This next test is I'm calling it the SCP test, Stop Chasing Pain test, because I learned about it from Dr. Perry Nicholson. He gave credit to Dr. Eric Cobb of Z Health. I'm going to make us do this procedure first before I explain it, and I'll tell you why afterwards. What you need to do is raise your eyebrows really big, really, really big, like your most surprised big eyebrow face. And then I want you to also, so that's step one. Step two is going to be you're going to smile like the biggest smile, the biggest, cheesiest smile you can come up with. So something like eyebrows. My face will look really great on this. Eyebrows up, really big smile, really, really. And then what I want you to do is while making that face, I want you to try and swallow. So let's do that first, and then I'll explain more. Eyebrows up, really, really big smile. Okay. Feel your tongue when you do that. It might be hard for some people to actually swallow when you're in that position, but a lot of times it's very common in people who talk about myofunctional therapy and otherwise to say like, hey, where's your tongue? Where's your tongue at when you're resting? And that's kind of a weird question for a lot of people if they're not used to thinking about that. Like, I don't know, where is my tongue? But when you make that really, really big grimacy face, and then you try and swallow, you're going to feel your tongue up on the roof of your mouth. So now that I've kind of explained that, try that one more time. Big eyebrows, big smile. I like to just kind of linger there for a second because I can really feel that my tongue is up on the roof of my mouth after I do that. And I think that's a rare thing. And it's really nice to have a way to kind of get back in to that position and have a checkpoint if you're ever like, I hope my tongue is resting on the roof of my mouth. Okay. For this last one, we're going to do the Bolt score. The Bolt score is also known as a controlled pause. You may have, I learned about it from Patrick McKeown's book, Close Your Mouth. I actually, even before that, learned about it from Jenny Hobson at the Hobson Clinic. She has really great education about different ways of breathing. So if anyone's looking for more information on that, go check out Jenny Hobson. But this is something that you can do, and it's kind of a good way to train, kind of check as like a metric, like where you're at with how your breathing is, and train it over time and have something to come back to check for comparison. So let me walk you through the test and we'll do it. And then I'll put in this video the values and what the values mean. And this is more about, I don't want to get deep into the woods on this video because that's not the point of this, but basically a lot of times when we think about breathing, we think about like primarily we're just thinking about oxygen, breathing oxygen in, right? But there's a whole gas exchange between oxygen and carbon dioxide in our body. And this test is a good way to kind of look at like how our body is doing with balancing it all. So you're going to want to just kind of get into a relaxed, kind of normal breathing pattern. Nothing too crazy. Might take a few minutes to kind of normalize because once you bring your attention to it, you get all inside your head sometimes. But you're going to just kind of take a small breath in and a small breath out. And right at the point in which you've taken a small breath out, you're going to actually plug your nose. And so I'm getting my stopwatch ready. Okay. All right. So mine was around 25 seconds. Again, I'll put a link to the values here. It's probably the middle range. Anyway, go ahead, see how you do. Let me know what questions come up. I just thought this would be fun and different to give you some tests that you can try at home. Let me know what you think. I am Dr. Julia. I'm a dentist that focuses on education and support around all things airway dentistry, and that goes beyond just looking at the teeth. If you have questions or if I can point you to more resources, I'd love to connect with you.